Welcome, everybody. Welcome back. This will be Module 2, Housing First Outreach Fundamentals of the Housing Liaison Onboarding Training. We are excited to be here and to talk to you about this. Again, I'm Sherry Downing, and I am with my dear colleague, Ann Denton. We are both coming to you from Advocates for Human Potential. Ann, do you want to add anything?
I just want to remind everybody that Sherry and I have been doing this for a long time, maybe longer than we want to talk about. And we're excited to have the opportunity to talk to you about outreach, which is a core of the work that you will be doing as a housing liaison with this group of very needy people.
Thank you. All right, so here is what we would like you to take away today. We would like you to be able to define the goals and process of outreach. We're going to want you to be able to describe common challenges and things you want to think about as an outreach worker. We'll talk a little bit about preparing for outreach and then, identifying and approaching people who are unhoused. We'll talk a little bit about how to engage with people. And then the all-important collecting data, which is sometimes a hard sell, because if you're drawn to this work, you're drawn because of what's in your heart. You may not be wildly enthused about collecting data. But this is critical. It's critical to the funding of the program, and it is also critical to being able to define who we're dealing with and how many people there are experiencing homelessness and what does that look like? So the data is important. And then we'll also talk a little bit about connecting to services. So what is outreach? I think you probably have a pretty good idea if you're a housing liaison, but I will just tell you that we look at outreach as the practice of seeking out people who are living in unsheltered locations or other kinds of locations that are frequented by people who are experiencing homelessness. And that could be libraries, shelters, food kitchens, or, food soup kitchens or food share kind of organizations. But the intent is to engage people in services and begin connecting them to housing opportunities. I want to just remind you that we work hard to use person first language, and that's really important in the outreach work. We don't want to say, we don't want to put the condition first. We don't say the homeless. We say people experiencing homelessness. It's a way of honoring personhood and offering respect. So I'm just going to put that out there. So I will move forward with talking about outreach just in that context. Here's the process overview. So you identify, engage, collect, connect. I kind of like that. But identifying is really finding the folks who need your services. It's an art and it's a science because it's not always obvious. I will tell you one very short story about this. For years, I was the person who put on the largest Project Homeless Connect kind of event here in my community. And it was a wonderful event that drew hundreds of people, volunteers and people experiencing homelessness. And I can remember walking up to a gentleman who had come to the event and saying, well, hello, and how long have you been outside and how can we help you? And he was quite taken aback because he said, I came to help. I don't need your help. I am just fine. But I had just assumed, it was a little scruffy, and he was dressed in sort of raggedy clothes that weren't particularly clean. And I made an assumption, and that was a huge lesson to me. And I apologized, and he laughed, and I put him to work, and life was good. But this was, it isn't always obvious. After that, forever after the many years we did it afterward, I would make sure that the volunteers all had very brightly colored, easily identifiable t-shirts. And that really helped solve the problem. Of course, what I also learned was that people who are experiencing homelessness are awfully generous with their time and they want to help, like we all want to help. And so every year after that first year, I had people saying, I was here for help last year. I'm here to help this year, although I will need to go through the services again because I'm not housed yet. And so, when they came to work, they'd put on their t-shirt, work until it was time to go through the service line. And then they would take off their t-shirt, walk through the service line, put the t-shirt back on and go on with the day. But this identifying people who need your services really is both an art and a science. And I think tone of voice, body language, room presence, all of those things can be really helpful. If you make a mistake like I did, if you aren't, if you can laugh at yourself, if you can apologize and be humble, that can go a long way to fixing the mistake. Engagement provides a foundation for success. So really, engagement to me is relationship building. It is finding common ground. It is sharing maybe some of your stories if there's a reason to share this story. Or things that you have in common, or, oh my gosh, I love, Mexican food too. It doesn't matter, but finding ways to engage and begin to create a relationship is critical to being able to help people through the outreach process. Collecting data, I talked about that a tiny bit already. Collecting data is key. It's key. It supports your work and ensures that services and programs are available and effective. And, it keeps money flowing in because a lot of times funding is contingent on the data.
Yep.
Anne, you want to add anything to that?
I was just going to say, when we were talking in module 1 about point in time count, that's a national effort implemented in each local community to count people. And to Sherry's point, that is exactly part of the data that HUD uses and that the federal government uses to allocate resources. And so it's absolutely essential. And it's also the same when you're looking at collecting data for someone who is unsheltered, unhoused at the moment. It's really crucial to getting them housed, in order to get them into the coordinated entry system that we talked about in module 1. They have to be assessed. In order to get them into housing, they have to be assessed. In order to get them into behavioral health services, they have to be assessed. And so this is such a vital first step that I think we're going to talk more about it as we go through this module, but I want to just echo what Sherry's saying. It may not be the most fun part of the process, but it may be one of the most important parts.
Absolutely, I agree. And then finally, in our little chain here, we've got connecting. And connecting is really getting people into the services. It's building a pathway to housing. It's helping people connect to whatever they need. And here, connecting is really important, but what's even more important is letting the person that you're working with drive the bus. You can't drive the bus. You can sit in the second seat. You can offer suggestions if it appears they're welcome. You can cheer people on. You can help them connect to the services and supports they need. But really, the person who is receiving the help is the expert on his or her own life. And so this is the reality. If you think they need treatment and housing and to go to the doctor because, oh my gosh, you've had that abscess on your arm for a month, and you say to them, where would you like to start? Housing, doctor, getting your social security card again? Where do you want to start? And they say, I really want to learn to play the violin. Then you say, let us do our best to figure that out, and do your best. You may be able to make it work or not. You've honored the person, and you've honored what they're telling you, and you aren't pushing your own views on them. You've got to let the person drive the bus. Now that's sort of an extreme example. And do you want to add anything there?
I just, in all the work that we've done and all the research that's been done about recovery and recovery from serious mental illness in particular, one of the things that seems to be a key driver of recovery is relationship.
Mm-hmm.
And outreach is relationship. And so if people get better through relationships, then you are starting the process of, you're helping this person either begin or expand their recovery. And it's a person-to-person event.
Absolutely. And I'll just add one more thing with the connection piece. If somebody needs to go to the Social Security office to get their card, to get a replacement card, it can be really helpful to go through that process with them, go in the door with them, sit with them as they're waiting to be seen. The reality is those kinds of visits can be not just to the Social Security office, but even to the Public Housing Authority or the local food bank or, the local St. Vincent de Paul who gives out clothing. These can be really triggering and difficult. If you've got somebody with you, it can make it easier to connect, and then you can begin to back off. But connecting people to services, what you're doing is really building that pathway to housing. I'm going to talk about identifying and approaching people who are unhoused. I like that language, unhoused, so much better than homelessness. I think it's good person first language. And I know I just visited a program, got to help with outreach and do a site visit. And this was the language they were using very consistently. We work with the unhoused. So, Anne, do you want to start us out on this?
Yeah, absolutely. I mean, I can remember from my very first point in time count that I participated in. We were given an area. It was my first time, and I learned so much from the team leader that I had about where to find people. I was wanting to tromp down the railroad tracks because I had this idea that people lived along the railroad tracks, and they were like, no. Over here is where the railroad tracks intersect with McDonald's parking lot. That's where we're going, right? And so knowing where to look is crucial. And the best way to learn that is from somebody who's already doing the work in your community. So you're the housing liaison, you're brand new. Okay, go talk to somebody who works at the emergency shelter, or talk to another outreach worker in your own agency. But knowing where to look is half the battle. And then being respectful yet persistent in your approaches. And then, like Sherry just said, meeting people where they are. So if my greatest need is, if Sherry thinks that I need to go to detox, right? And I have a toothache, I don't want to hear it. I don't want to hear it from her, right? I want somebody to help me with my toothache. So I think assessing, identifying, and responding to the priorities of the person that you're seeking to serve is absolutely essential.
Could I add one thing there?
Please.
And I'm just going to say, I'm going to pretend that you're a brand new outreach worker. Anne, do you just march right up to people? Do you go right open the flap of their tent if they have a tent and poke your head in? Do you walk right up and make yourself at home and sit down on a rock and they're around their campfire? Is that how it works?
I'm a brand new outreach worker, so I don't know the answer to that, Sherry, but it doesn't sound right.
And you are right. That is, so I was testing you, but but no, it's important to remember that you are, no matter where you are connecting with somebody, you've got to give them their space and treat that space respectfully. You are engaging people often in their homes, particularly if it's a campsite or under a bridge. I've been under bridges where I've seen people have hauled mattresses up and have pictures of their loved ones along the ledge of the bridge, their books. This is someone's home, whether it looks like a home to you or not. And even if you meet somebody outside the food kitchen, for example, you've got to be respectful. Approach as you would any other stranger, any other person you don't know well. And I know one of the things I've seen veteran outreach workers do is stop at the very edge of a camp, or even the edge of the forest where the road meets the forest, and say, hello, I'm here from XYZ program. Can I talk to you today? And
Right.
sometimes people will, and sometimes they won't. I mean, is that your experience as well, Anne?
Yes, I was at a campsite. I was out with an outreach worker on a site visit, and we were going to a campsite. And as we parked our cars way far back and walked in. And one of the interesting things is you can almost always find a path. Once you learn what to look for, you can see it. Anyway, so we walked down the path and I couldn't even see the tents. And the outreach worker stopped and identified himself and reminded them that he had said he was coming today. And we were invited in. And it was an extraordinary experience, but it was very definitely the respectful approach that I think that got us into the confidence and into a place where we were able to be of assistance to the people who were living there.
Thank you.
Yeah. So I think back to this slide, I mean, I think knowing where to look, like I just said, you ask other people who are doing the work, and you go to shelters, soup kitchens, underpasses, and encampments. In suburban areas, it could be a little bit harder, but in the suburban areas that I'm familiar with, you're still going to find people who are just off the beaten track, but they're not going to be too far out. They're going to be close to a convenience store or close to, a bus stop, close to something that connects them to the community, even though they're not in a housed condition. And then in rural areas, again, people are not, most of the time, they're not 2 miles up the mountain. They are, they may be hidden, right? They may be hidden from view, but they're going to be living somewhere that allows them to live, like on a creek or close to an RV or campground. There was a gentleman I met in Washington State. All he wanted from the community mental health center was a camping fee so that he could go camp in the campground. So again, knowing where to look, it's not rocket science, but it actually takes some thought. I can't set off and go.
I'm going to go back 1 second. Okay. I have spent my life in rural areas, and I will say Anne is absolutely right. People are going to be close enough that they can get in for the goods and whatever services are available that they need. But I know that they will also live in abandoned structures. So I met a couple one time I was helping with Point in Time, and we'd set up a station at the local food bank. And my friend who ran the food bank was sending people over to me. And she said, I'll just send people that I think are appropriate for the Point in Time survey, and then you can ask them your questions. And so pretty soon a lady walked over to me and she said, well, she said you might want to talk to me, that you're doing a survey or something. And I said, I am. I would love to talk to you. I said, are you unhoused? And she said, oh my gosh, no, we have a place. And I said, oh, good for you. Tell me about your place. And she said, well, it's up the gulch a ways. And people can be sort of secretive about where the up the gulch a ways is, because it can put them at risk if people know where they are. But she said, we're up the gulch a ways. We actually found an abandoned trailer a couple years ago. And she said, now it didn't have windows or doors, but we've got some plywood nailed over and it's okay. And she said, we've been there a while and eventually we plan to move on, but our truck is broken down. So, right now we're just bringing the wagon down when we want to access the food bank. And I said, okay, well, I live in Montana. It gets really cold here. I mean, just a week ago, it was 20 below zero. It gets really cold. And I said, how do you stay warm in the winter? Oh, she said, we've got, and it tickled me, but she said, we've got goats. We have goats. We keep a little herd. And when it gets too cold, we bring them in for the body heat.
Yeah.
And she was so, and I said, oh my gosh. And she said, and I found people, when you talk to them and open yourself up to hear what they want to say, they're unfailingly generous. And this woman was the same. And she said, would you like a goat? And I said, oh my goodness. Well, I don't think Elsa the boxer would enjoy having a goat in the household, but I appreciate the offer so much. And we went on and had a lovely chat. But people, I think, particularly in rural areas, what you will find is that people do not view themselves as being unhoused, right? She had a place. She had a roof over her head and a place she could go and a place she felt safe. And I will say that it is critical to recognize that and be incredibly non-judgmental and open. And I don't know what you'd add to that, but I just thought it was important to add that rural piece.
Absolutely. And I think that's everything that you just talked about is a perfect example of approaching for the first time, which is our next slide. I think we've said it a couple of times, but I don't think it can be overemphasized. You are approaching someone who is an adult human being, and they are survivors, or they would not be able to live outdoors successfully. They have a lot of strengths. When we get to module 3, we're going to be talking about strengths-based assessment. And the fact that someone is living in a trailer for a couple of years successfully is an enormous testimony to their strengths as a human being. So, the general advice when you're approaching somebody for the first time is to tell them your name. Hi, my name's Ann. I work for XYZ agency. Or I've seen outreach workers go, hey, Kevin here, outreach worker. Can I talk to you? Again, raised voice, because you're doing that from a distance, right? Be respectful and natural. If you're naturally kind of a person who laughs easily, be yourself. If you're more serious, be yourself. But the key is to be respectful. May I ask your name? May I call you by your first name? Do you mind telling me a little bit about yourself? Non-threatening, and that's both verbal and nonverbal. I think we've talked a little bit obliquely about how you approach, but I think your body language needs to be non-threatening and almost, I would say, deferential, almost like this is your space and I am backing up out of your space because I would like to speak with you, but I don't want to force the issue. The other thing that I find to be, in my observation, is that it's absolutely crucial, is have something with you that you can offer people. I don't want to talk to Sherry if all she wants to know is what my birth date is and where my mother lives. No, that's none of your business, right? But if she has a clean pair of socks for me, I might talk to her, right? Or if she has a cup of coffee, I will definitely talk to her. And so most agencies in this day and age have a stockpile of things that you can take on outreach. And if you don't have that, I suggest you work internally to get it. Socks, grooming articles, shampoo, soap, baby wipes are particularly helpful. And
Feminine
then
hygiene products,
hygiene products, yes, for women,
insect repellent,
insect
sunscreen.
repellent,
Yeah,
right?
absolutely.
Menstrual, management products for women. I think, just the kinds of things that are useful for people who are unhoused. And then following that, you can sort of work in the idea that you might be able to help them do something beyond that. So you might be able to help connect them to a doctor or a dentist. You might be able to help connect them to mental health services, right? Some people are welcoming that because they've had that before and it helped. You might be able to connect them to a better pipeline of food and shelter than they have now. And so the whole purpose of your approach to people is ultimately to help them make choices about their living situation that, if they choose to improve where they're living, you can help them with that.
I would just add, this is a housing first project.
Mhm.
And of course, we want to get people into housing. We want to get them into housing quickly. It needs to be permanent and low barrier. But don't make promises you can't keep. You can't say, I can get you a key tomorrow if you can't for sure get them a key tomorrow. You can say, I can, let's begin working toward housing, as low barrier. It's permanent. We want to get you in. It might take a minute. It might take a week or two or a month or two or whatever is realistic in your community. So don't make promises you can't keep, but you really do want to begin moving people toward housing.
Mm-hmm. Absolutely. And I think the very first place that you start in that conversation, again, if the person is willing, and like to Sherry's point about the story she just told, this woman did not think she was unhoused. So you ask what's the living situation right now? And I love the question, tell me more about that. Tell me more about that. You're just trying to determine what the current situation is. Where did you spend last night is an excellent question. And it has actually right out of the point in time survey. But it's a good way to tell, if they said, well, I spent the night in a tent or none of your business, it's a indicator. So really what you're doing, and this may not be on the first approach, it might take a minute, but you're really asking some questions to try to get more of a global picture of what people might need. And people often talk to you about their physical health before they'll talk to you about their mental health. And people might share with you, if they've got an urgent need. So if they've got an infection, a foot infection, which is very common, that they're scared about, that they might tell you about that way before they tell you about voices that they're hearing.
Absolutely. And I think emergency needs can be absolutely critical, because we know that if people are unhoused and they're living in that state for a while, that even small physical problems can snowball and become big physical problems. I knew a guy one time who walked about 7 miles clear across town to go to an emergency room for a tooth that was so abscessed that he hadn't been able to chew for a week. And he was so sick and ended up in, in actual care. They put him in the hospital. And later the tooth was, they, treated him with antibiotics, and later the tooth was extracted. But one of the things that we're seeing oftentimes in communities, more and more, we're seeing medical respite centers pop
Yes.
up. And, if there is one in your community, that's a great relationship to build, because those are really for people who are coming out of hospital care and have nowhere to go. The nice thing about having a little respite where your needs are met, you've got a bed and food and a washing machine and a shower and connections to agencies and human beings who work there. And many are bridging people into housing. So it can be a great first step. I don't often bring that up, but I do think that the respite centers are more common now and really making a difference.
Oh, yeah. I mean, I can't tell you how many times I've heard stories of people discharged to shelters. There was a person who had a leg amputated and the hospital discharged him to a shelter, and the shelter was like, what do? We can't help, and so medical respite is such a blessing. One of the things that I wanted to talk a little bit about is the kinds of things that you might see in terms of like physical health or crisis. And so this slide talks about vulnerable individuals, but the kinds of things that you might see that are a crisis situation, let me go back to the previous slide, on the edge, emergency needs. We talked about foot problems, dental problems, sometimes vision problems. We've got people who have chronic lung disease. And then you've got people out there with cancer. And other kinds, you might see people who have who are suffering from the symptoms of HIV/AIDS. Thankfully, less prevalent now than we have been seeing that in the past. But all of these factors roll up into people who are particularly vulnerable. And I think it's important to pay attention to people's history to the extent that they will share that with you. I want to spend a minute talking about co-occurring psychiatric and substance use disorders, since there are a significant subset of people, most of them in the chronic homelessness group, who suffer from co-occurring psychiatric and substance use disorders. And so you're going to see that as you do outreach.
I would just say that across the country, one of the things we're seeing, and I would venture to guess that you're seeing it in Missouri as well, is opioid use disorder.
Yes.
Particularly fentanyl has made horrific inroads into our communities. So taking a harm reduction approach and carrying Narcan can be really useful, because those are critical and emerging problems that you're not unlikely to see.
Right. And that brings up for me, Sherry, the other end of that. I mean, you're talking about being able to respond to somebody's life-threatening crisis. They've had too much fentanyl, you know what to do, right? But the other thing that you want to be alert to, especially if you're out, is if the situation doesn't feel right, leave, right? You may walk up on somebody on a encampment where drugs are involved, and maybe they're selling drugs, or maybe they're using drugs in that moment. And if it doesn't feel right, turn around and go away. There'll be another opportunity.
Absolutely. And the other thing I was add, particularly if you are even in a city, if you're going into the alleys and if you're in the country and going up the gulches and gullies or under bridges, don't go alone.
Yeah.
Really, and don't go without letting somebody know where to find you. What we know about people experiencing homelessness, particularly with serious mental illness or co-occurring disorders, is that they're at greater risk from us.
Yes.
Than we are from them. That said, it is just good practice to make sure that you go along with somebody, hopefully somebody that the person knows. If you're new to this work, that can really help smooth the path to getting to know someone. But beyond that, it's also just a safety protocol.
Yeah.
Go with a partner, trust your gut, as Ann just said, let somebody know where you'll be, check in when you leave.
Yep.
Don't carry anything don't carry all your valuables with you. You know, a lot of times I'll even take off my jewelry and leave it back in the office, just because you don't want to set yourself up. And that is not saying that people are inherently evil or bad, but it's just better safe than sorry. Is that overstated, Ann?
I don't think it's overstated at all. And I mean, I want to reiterate and emphasize that the people that we're serving, people with serious mental illness, people who are unhoused, people who are sometimes in desperate situations, remarkably nonviolent, right?
Right.
And as Sherry said earlier, sometimes helpful to a fault, right? They want to help other people. But I think that if you're doing outreach and you're out, you don't know what you're walking into. So you may walk into an encampment that is not that population, right? And there's a lot of, within the homeless population, I think that's not people first. Among groups of people who have been homeless, there is a lot of predatory behavior where people who are comfortable with criminal activity take advantage of other people who are also in the homeless situation. And so I think just use common sense. There's no need to be scared of our people, but you got to watch out for the others. Okay. So the other thing I think what this slide is talking about is, what if you come up on somebody and they're having a heart attack? What do you do? Right? Well, you call 911. What if you come up on somebody and they're having, they're telling you that they don't want to live anymore, right? They're saying, I don't need your help because I'm not going to be here tomorrow, right? What do you do? And, what the slide says is that you understand what your legal obligations are, you understand who to contact, and then I think, and how to get somebody to emergency services, and kind of like knowing when you call 911.
Mm-hmm.
And it's a judgment call. And I would always say err on the side of caution. Better for them to be mad at me than dead.
And I will say, people have often been, I would say most of the time, people experiencing homelessness have been treated disrespectfully in emergency room settings, and, in settings where most of us would feel very comfortable just walking in and anticipate having our needs met. That's not necessarily the case when you've been trying to survive homelessness for a while. I've seen frostbite so horrible that people's toes have had to be amputated. There was a woman who had a sore on her finger. This was a caseworker I knew pretty well, and she'd been working with this woman for a while, and she kept saying, we really need to get you into the doctor because that finger looks awful. And she's like, nope. I've been there. I've tried that. Didn't work. They were rude to me. But one day she went to see her, and the finger was so swollen. It was just huge. The hand was black. I mean, it was really scary. The woman was clearly in pain. And she said, please, I'll go with you. I will sit with you however long it takes. I won't let you deal with this on your own. And they went in, and ultimately the finger did have to be amputated. It was that bad. But afterward, they walked out, and the finger wasn't amputated that day, but they'd given her antibiotics and wrapped it and cleaned it. And then she just took her to one of the local fast food places and said, get whatever you want. And the woman ordered the biggest sandwich on the menu, this huge sandwich, and ate it all. But she just said, to the caseworker after that, that's the kindest anybody has ever been to me.
Yeah.
They were able to build a relationship, and they were able to get this woman into housing first, shortly after that. And she went on to become a peer, a certified peer worker who made a big difference for other people. But it was really that I'll sit with you, and after we're done, buy you the biggest sandwich we can find.
Yeah. Yes. And I think, yes. And so this section of this training module has been all about, how to approach people. And Sherry and I have, of course, leaped ahead into how to engage people. Because for us, it's all the same thing. But I think you can summarize the stories that Sherry and I have been telling by this slide, which is in those stories, we're really developing a collaborative relationship with someone, and you pay attention to what they're telling you. Sherry told the story about the violin. Meet the person where they are, right? We want to listen carefully, because for many people, it may be the first time someone actually listened to what they're telling them. The other thing that I want to remind us all is, as we talked about in Module 1, the experience of homelessness is traumatic in and of itself. And so you're dealing with people who have been traumatized by the experience. The first step in engagement is building rapport. And again, it comes back to where do you start with people? By how you approach them, how you, my favorite image is, I saw an outreach worker do this time and time again, instead of person A facing person B, right? And person B, who's got the clipboard and is writing down the data, right? Is that person A, the person who's unhoused, is approached. The person A says, yes, I'll talk to you. And person B sits beside them, right? Not head to head, but walking beside, sitting beside. For me, that image sums up respect and a willingness to really go the distance to help somebody, to find a way to help somebody. So this slide talks about offering ongoing support. One of the things that really helps when you're doing outreach is being consistent. So I've engaged with Sherry. She's accepted my cup of coffee. We sat down on a rock and talked about what she needs and wants and what her dreams might be. And then I say, I'm going to be out this way day after tomorrow in the morning. Would it be okay if I look for you? Would it be okay if I look
And
for
I
you?
say, I am really busy mornings. I have to get over to the shelter because they offer breakfast. And then sometimes it takes 30 minutes to get through the line. And then I've got to visit with my friend Joe. So mornings are hard for me.
Yeah. And I say, so maybe I'll just adjust my schedule so that I'll be out here in the afternoon, or I could meet you at the soup kitchen.
Well, that might work okay. And then I could introduce you to my friend Joe.
Exactly. And so that little impromptu role play, I think illustrates some of the points that are on this slide. I'm building trust. I'm helping her build trust, and we're building trust together in our relationship by me being willing to accommodate what she says she needs, instead of the kind of situation where it says, you have to come to my office at 10 o'clock on Tuesday, or we'll discharge you. Some of our systems do that. It's a completely different approach.
And I love that. I think you summed that up particularly well. And I think being aware that people are busy. It can take a long time to get from point A to point B. And if you have to do that just to, manage your needs, that's hard. It's important to remain that respectful and not judgmental and open. And I think, again, just not to belabor it, but body language, tone of voice, being true to your own nature. If you're a person who laughs and jokes, that's great. If you're a hugger, I would say just be careful that you always ask before you touch someone. If you're not a hugger and they want to hug, if that's not something you're comfortable with, you can say, I'm just not a hugger. I think being true to yourself, because just like you would making any new friend. And although I will say this is not a friendship, this is a professional relationship. And yet it's using the same skill set.
And yet it's a relationship.
Yes.
So within the relationship, and I'm going to let you lead this part of the module, within the relationship, we're also collecting data, right? And we talked earlier about how important that is. And so within that, I think one of the keys, and then I'm going to stop talking and let Sherry talk for a minute. But one of the keys is to be transparent. Once you've got a relationship, you say, part of my job is to help you connect to stuff that could be helpful for you. And in order to do that, I'm going to have to ask you some questions. And if that's okay with you, I'd like to do that.
Absolutely. And this, I will just stress this part. It's an iterative process. I know I brought SOAR, SSI, SSDI, Outreach, Access, and Recovery into my state, Montana, and learn to do the SOAR applications. And that can be a process. There are a lot of steps to get an SSI application built. That is not dissimilar to this. As you build this relationship to gather the data you need from a person, it's iterative. You are not going to get it all at once. You need to be extremely aware of body language and comfort level. And if somebody doesn't want to answer one of your questions, do not push.
Yeah.
Even if they don't want to tell you their name for the first time, write down, and this is consistent with HMIS, write down a personal, something that will help you remember who you were talking to. Maybe it's Bill by the bridge, or blue hat person, or whatever it is. Document what you can, and something to build from. So they may only give you their first name. They may tell you their name. I've had people tell me their name is Donald Duck. And I say, well, thank you. May I call you Donald? But you just treat it as if, which is a lesson I learned from my friend Ann. Act as if. Yeah. So if they say Donald Duck, you say, thank you, Mr. Duck. May I call you Donald? And he may or may not say yes. Document where you interacted. Where were you? That's going to help you find the person again, maybe, but people do tend to be relatively tied to specific geographies and locations, so it can be useful. And then ask, how do I reach you again? What if I lose track of you? Is there someone I could call to check in on you? Mm-hmm. And sometimes people will offer that. Many times they will. Sometimes they won't. But that all speaks to often the trauma that people have survived in their background. So why does the data matter? Well, we talked a little bit about, it does have some funding implications. It also gives you information that you can use to talk about what you do. We served 323 people last year. Almost all of them were living without homes. They were unsheltered. We were able to house 50% of those folks. And now they're safely in Housing First. So it also prevents duplication of effort. So I may know somebody as, Billy by the Bridge, and that's all fine and dandy. But if Anne is serving, William in the shelter, if they're the same person, we don't want to count them twice. The data needs to be,
Right.
unduplicated. It helps us meet people's needs more efficiently and effectively. So if Anne is searching for housing for William and I'm searching for housing for Bill by the bridge, that could be problematic on its face.
Yeah.
And then I'm going to ask Anne if she wants to weigh in after we talk about this next one. But this is critical. Funders require agencies to report on program activities and outcomes. HUD wants to know. SAMHSA wants to know. I would say that your agency wants to know, maybe for a host of other funders that it works with. So they want to know what you've done and how it's worked out. And that is critical to ongoing funding and our ability to help. So, Anne, what else would you add to that?
No, I would just say, like we started, be transparent. This is part of my job. If you don't want to answer the questions, I respect that. Right. But be transparent. And then also, if Sherry says to me, why do you want to know? Right.
Mm-hmm.
I can say just what she just said.
Right.
It helps us help you better. And it helps us as a community get the money and the resources we need to help lots of people who are unhoused.
And once somebody is formally connected to your program or to a continuum of care program and needs to be entered into the homeless management information system in your community or HMIS, you will need to get a release of information from that person to be able to name them. Otherwise, you'll have to use a personal identifier. But you're at every level, this is important. And it's not popular, but it is important. So
yeah, and I think, sometimes people are going to balk at being in a computer system and, just respectful persistence. And, the world's not going to end if that person doesn't go into HMIS today.
absolutely. Or if they have to go into HMIS under
A pseudonym.
a pseudonym. Thank you. I could not come up with that word for the life of me. So yes, under Donald Duck.
Right, Mr. Duck.
Mr.
Right.
Duck. Connecting to services. So we've talked, I think the fun part about this conversation has been we've kind of woven it all together, but let's talk a little bit about connecting services. So, Anne, do you want to start this one?
Sure. I am happy to do that. So we're going to talk more about this in a subsequent module. I think it's in module 3, but talking to people about what their needs and preferences are. And we've already talked about that in this module. But if you get somebody who is willing to sit down and talk to you, there was a woman I met, I think again, it was in Washington State, and she had cancer. And she was scared, right? And she didn't want to trouble her boyfriend with it, but she really would have kind of liked to go to the doctor. And that only came out because we were talking about needs and preferences beyond, I need a new pair of socks. But what would it take to help your situation? And then offering options, although I would reiterate Sherry's warning, we cannot pretend to be able to give people something that we cannot. If we do that, all the rapport building in the world goes up in smoke, right? Because you have just really lied to them. Again, just like everybody else lied to them before.
You've got one chance. And that is the truth. You keep your promises, you do what you say you'll do, you don't overpromise, you don't not show up if you say I'll be there tomorrow, because these oftentimes people experiencing homelessness have been let down over and over and over again. Mm-hmm. And they often will not give you most of the time, in my experience, most of the time, don't get a second chance.
Right. Agreed. And then this last box, we're going to talk more about all of these, but support transitions. I think if I've created a relationship with Sherry, and then all of a sudden, 6 months from now, she's going into housing and she's going to have a new caseworker and she's going to be meeting a new doctor and she's, blah, she could be scared. It's my job, to the extent that my agency will allow it, to help her transition. So to do a warm handoff, as they say. So let's talk a little bit more about determining needs and preferences. You have to have established a rapport before people are going to tell you what they need or what they want. And I have a story about the words housing first. So Sam Sembaris from Pathways to Housing in New York City, he was the pioneer of housing first. Mm-hmm. And what he says about, somebody says to him, why do you call that housing first? And he said, because when you ask people what they need, they don't say, I need an individualized treatment plan first. They say, I need housing first. That's where it came from. Kudos to Sam. And that reiterates the point, I think, that we need to talk about in terms of this slide. Again, it's about listening to what people are telling us. Lots of times I've met dozens of people who are unhoused and what they want is a job.
Absolutely.
They don't want any of your nonsense about counseling or psychiatric meds. They want a job. They want a cell phone. I want a cell phone.
If they don't already have one, and many do.
A lot of people do, yeah. And I think, as you talk to people about what they want and need, and this is beyond socks, right? Medical care, a bus ticket back to their family, whatever it is that they want and need. We really need to also help them make the connection between what they want and need and getting entry into the system. We talked in module 1 a little bit about the coordinated entry system. And what that means is that, just like Sherry said about the data, we enter people into the homeless management information system through a coordinated entry process and a standardized assessment. And that's the key to them accessing some of these, more substantive services like finding a job or getting housing.
Absolutely. And I think one of the things, if we think back to what we talked about yesterday with the continuum of care, bringing all the folks who represent these services together in one room to, sort of make a collective group of services that people can access as needed is absolutely, it's a brilliant strategy, and it's an important strategy, because certainly we can't all offer every single one of these things.
Right. Is it perfect? No. Have I heard case managers complain about it across the country? Yes. But it is a system designed to deliver what people need. And as Sherry just said, I'm grateful we have it.
Yeah. And I would say, just to Anne's point with the housing first, I loved that story, Anne. I'm going to steal that next time I'm doing this without you. But I will say that when we first started this work, clear back when Philip Mangano was the homeless czar and was going all over the country and people were creating 10-year plans, he often said, if you ask people what they need, they have never said a pill or a program. What they're going to tell you is, I need a house and a job.
Yeah.
And that's even when people are desperately ill. It's a house and a job. I mean, those are what you will hear. People want to, they want to contribute. I think it's a basic human need. And in order to do that, you've got to have housing first.
I love it. And once someone gets into housing first, like we previewed a few minutes ago, if that person is willing or they're scared and you want to offer, doing the warm handoff can be absolutely crucial to their success. And it might take a month of your time, right? working with them, helping them do the transition, introducing them to their new caseworker, going with them to see their new doctor, walking them through their new apartment, whatever it is, to make that transition user-friendly for them really facilitates their success.
I agree. One thing we didn't mention yesterday, I'll mention it today, is that at the end of each of these modules are the resources, some references you can look at later if you choose to. I think they're all pretty much hot linked. So with that, I think we have completed module 2.
Thank you. And we'll see you in module 3.
Person-centered planning and setting housing goals.
All right.
All right. Thank you, everyone. We've enjoyed being here for you.